Hello, everyone, and welcome to this session on mental illness in the student population and the impacts for educators. My name is Dan Wright, and I will be the facilitator for this session. Before we begin, I acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. I pay my respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. I am coming to you today from the Gold Coast, which is the land of the Yugambeh and Komomeri language peoples. If you would like to acknowledge the traditional custodians of the lands upon which you are currently on, please feel free to do so by telling us where you're coming from in the chat. Today, TTA also thanks Captioning Concierge for their expertise in providing live capturing and for the support provided by the TTA corporate affiliates. I would like to introduce our speaker today, Brandon Taylor. Brandon is the Mental Health and Wellbeing Strategy Manager for TAFE Queensland. Prior to this, Brandon was the Student Support Manager serving the Brisbane region. He has worked in the vet sector as a teacher, disability officer, manager for 18 years. He has taught literacy, numeracy, and life skill programs with disadvantaged youth, discrete learning programs for adults with disability in the workplace, and additional support programs for students struggling to maintain their vet studies. He has maintained multidisciplinary student support teams, including counselling, disability, Indigenous, and international student welfare. The format of today's session will be a presentation from Brandon, and then we will have a Q&A session at the end. You are, of course, welcome to use the chat function for your chat and commentary throughout the session. But if you have any questions for Brandon, it would be appreciated if you could please type those into the Q&A box. I'll now hand over to our presenter, Brandon Taylor from TAFE Queensland. Over to you, Brandon.
Thank you very much, Dan, and good afternoon, everybody. I will just share my screen and we shall get underway. Well, let me first of all just say, so great to see many of our colleagues across TAFE, across the country today, and particularly thank you for joining this session in the final stream of our Open Doors event. There's been some excellent presentations, discussion, commentary, and Q&A. So we're going to round off the afternoon in this particular topic. I appreciate that we've had an acknowledgement of country, and there are some chat comments coming through letting us know where you are from. I'm also from TAFE Queensland, and we noticed in the keynote address at the start of the day, we were fortunate to have Leanne Bell. I'd like to also just share this slide with you from our acknowledgement of country, because there's one line in here that really I just think is a wonderful, wonderful addition. And it is the line that says that we recognise that teaching and learning has taken place on country for over 60,000 years, and two-way learning is an important part of our reconciliation journey. And since that was added into the wrap, and you'll know from my accent that I'm not originally from Australia, I just think, particularly for education and training, what a wonderful line that is. So I just wanted to acknowledge that. It's something I like to flag in all the training and presentations that I do. So today, yes, I'm going to attempt to address 4 key questions. And I'm also going to make reference to some of the more recently published research and that data and what that suggests. Not only does this research provide useful insight and considerations for ourselves as TAFE and also as vet practitioners, but I think it's fair to say that for most of us, getting the opportunity to look at some of this research is actually quite challenging. I'm certainly not in a position to conduct research, so it's really important that we have the opportunity to see, well, what are the lead agencies and bodies out there actually finding? What's the evidence? What are the trends, if you like? And what can we get some insight to? I would also like to make one further acknowledgement and that is to everybody online who has lived experience of mental illness, whether that is yourself, a family member, a friend, or through your roles within your organization, colleagues and students. Please make sure you look after yourselves today, particularly if we cover anything that you feel is particularly pertinent to you, or it brings anything up for you. And I trust that everyone can appreciate in one relatively short session, there may be some generalizations that I have to make. There may be some broad statements, because it would simply be impossible to address each and every single situation or example. But I do feel it's important to give that acknowledgement. So when we ask the question, are more students disclosing and displaying mental health problems or mental health concerns? Well, it seems a little obvious, but it's where we need to start. The overwhelming response from the educators and the industry trainers that I speak to over many years will always be absolutely. We recognize that we have always had students within tertiary education who are experiencing a mental health concern or indeed have a diagnosed mental illness. Our own observations are that over a number of years, the numbers, if you like, have actually been increasing. But interestingly, there's a lot of support from educators that it's not just the numbers, it is the complexity of what is being presented. That's what certainly teachers and industry trainers are telling me. It's the complexity that's also changed. I think it's also important to just acknowledge COVID, the significant event that it was. But this topic of conversation about mental health concern in our student population, we've been having this conversation as a hot topic, certainly for 10 years now. And I make the point because this is not a symptom of COVID. This has been around for many years. Of course, COVID brought its own challenges, some pros and cons about study and its own mental health and wellbeing concerns. But what we're talking about today absolutely goes a good number of years prior to that. We know from the research that's been around as well for quite some time that 3/4 of all lifetime mental health disorders will have emerged by the age of 25. So that tells us very clearly when we think about our student population. I can tell you in TAFE Queensland, it's pretty much 50% of our entire student body across Queensland would be 25 and under. So that tells us that it is absolutely to be expected that a significant number of our students will experience a mental health concern for the first time whilst they are a student. And again, just to emphasize that this is nothing particularly new, if we go all the way back to 2004, the World Health Organization stated that by 2030, which of course we're a lot closer to now, depression alone would be the leading cause of disease burden globally. So these concerns about mental health and what is something changing and what are we doing to respond to mental health, both individually in the workplace, within education and community, society-wide, these concerns have been around for a number of years. So let me move towards what some of this data and evidence and what's publicly available is actually starting to tell us. Well, for those of you who don't know, Mission Australia each year year-olds. And this is to capture the personal concerns, the national concerns, environmental concerns of our young Australians across all states and territories. And each year, it's over 21,000 15 to 19-year-olds take part in this survey. And interestingly, that survey itself has been around, I believe it's about 21 years now, and each annual report is publicly available. Now, since 2012, that annual survey has also included a measure of non-specific psychological distress using the Kessler-6. You may know that as the K6. And that 6-item scale of non-specific psychological distress is particularly powerful at detecting depressive and anxiety disorders. And essentially what this does is, at the time that the individual, this 15 to 19-year-old, completes the survey, the Kessler-6 asks the individual if they have, in the previous 4 weeks to the survey, felt that they were either nervous, hopeless, restless, so depressed that nothing could cheer them up, that everything was an effort, or that they felt worthless. So quite incredible questions, really. And they're able to respond from either not at all through to some of the time, almost all of the time. So what we can get from this now, because that itself has been running for a number of years, is some trends. And that's what we'll have a little look at first of all. So this table shows us the rates of psychological distress in young people going from 2012 right through to 2020. And what we can see is that generally those rates of prevalence have increased. So the blue line in the middle is all of those young people who showed psychological distress, increasing from 18.6% right the way up to 26.8%. The top line is our young females, and the bottom line are our young males. So what we're seeing generally is an increase for young males. For young females, the increase is significantly more, and the rates of psychological distress are significantly more. In fact, they are over double. So both have seen an increase, but the increase is much greater in our young females. Interestingly, we're getting some more insight now into our young First Nations people across Australia. And I've just decided to pick out this one particularly that separates our Aboriginal and Torres Strait Islander 15 to 19-year-olds. And what we can see is that there are always, from 2012 to 2020, there's always been a higher rate of psychological distress compared to those who are non-Indigenous. So interesting observation that we have that data to support that. And that higher proportion is approximately about 8% higher. Now from there, if we look at the last 12 months and the most recent annual survey, and this kind of question is asked every year, young people are asked about what are their top issues of personal concern. And they are able to select from that whole list that I'm showing you. And I appreciate that's a lot of information on the screen. So let me just highlight the top 4 issues of personal concern are coping with stress, school or study problems, mental health, and body image. And it's interesting that this is consistent with the previous year, and typically these issues of personal concern, maybe not surprisingly for the age group of 15 to 19-year-olds, are consistently there. Interestingly though, mental health appeared about 4 or 5 years ago, and that is something new. So this shows us what our young people are either extremely or very concerned about at personal level. one other thing that I have picked out is to just to make a reference to screen time and mental health prevalence, because there's a lot of conversation about, well, is this screen time that we seem to be spending more time on our devices at all ages having an impact? Well, what some of these reports are telling us is that of those who report those very high levels of psychological distress, they are in fact spending 9 or more hours a day on their devices. Probably not surprising that they are also the young people who have the least amount of sleep, often between 4 and 6 hours per night. And they also tell us, probably not too surprising either, that they actually take part in no exercise. Now, I'm going to take straight from one of the Black Dog Institute reports, and I'll provide you all the links to these. Interestingly, that's suggesting from the Black Dog Institute that it doesn't suggest, I should say, that excessive screen time causes mental health problems, but rather suggests that those young people with mental health concerns actually go to their devices and spend longer on their devices. And there's certainly going to be more research in that space to try and understand exactly what that is. Is it for coping? Is it to escape? Is it to seek advice? So it's not that the screen time is causing the mental health, it's rather that the mental health concern is there and the individual goes to their device. And what we know, not just with young people, but particularly when we deliver mental health first aid and similar courses, is that most people across the age range don't actually seek help. And this is particularly true in our young people and our young students. They don't seek out help. So they remain undiagnosed and therefore they remain untreated. So quite interesting what's actually happening out there. Now, if I take it a step further, of course, when we look at this kind of research, the real question that many of us want answered is, well, why is this happening? And what actually has changed? And, you know, what can I say? It's a little bit like some people's Facebook status. It's complicated. It is, there's a lot of dynamics here. But we are starting to get this sense of actually the research is now telling us some further details that we didn't have even just a few years ago. And there's an excellent report that came out at the end of last year. And I encourage you to look at this. It's from the Black Dog Institute. It's called Turning the Tide on Depression, a vision that starts with Australia's youth. And not just from an educational perspective, but if you are a parent or a grandparent, whether you have a very young child, you have a teenager, or you have a young adult in their early 20s, this is a particularly interesting report because it seeks to answer a number of questions, the central one being, are our young Australians experiencing higher rates of depression than in the past? And if so, why? And when we say in the past, we're actually referring, or the report is referring to the previous 2 decades. So it looks at how childhood and adolescence and young adulthood has changed over the past 2 decades, how social factors may actually be increasing young people's risk for depression. And very interestingly, it examines the unique experiences of our young First Nations people. So adolescence, for the purposes of this, is that age period from 10 to 19, which we know, of course, is a significant time of physical, psychological, and social development. It's also a time marked by a sharp increase in the onset of depression. And we know that when depression occurs in those early years, in those teenage years, it can have a host of adverse consequences. It absolutely can derail a young person's schooling or TAFE or university. It completely disrupts their social and emotional development, and it can actually cut them off from so much connection that their age peers without depression actually have. And there is data that shows us that adolescents with depression in high school will actually miss up to 20 days a year directly from the depression, and they're more likely to have poor quality friendships compared to those age peers who don't have depression. So the evidence is suggesting that adolescence has changed over the last couple of decades. And we're starting to get a sense, both from Australian research and internationally, that actually adolescents are taking longer to reach some adult milestones. Interestingly, you may be surprised to know that fewer Australian adolescents are actually obtaining their driver's license relative to previous decades. And what we know is that from the report, it tells us that this kind of change is occurring alongside some other similar declines, in that adolescents are not working in paid roles as much as they used to, that there has been a decline in the number of adolescents going out of the family home without their parents. There's a decline in adolescents having romantic relationships, and indeed, when it comes to things like drinking alcohol, which probably isn't a bad thing. So sometimes this seems a little bit surprising. And alongside this slower progression through these adult milestones, there's been a concurrent rise in the exposure to adult, or what we'd certainly say is at least developmentally inappropriate content through digital media, and of course with this continuous boom of social media platforms. And to add to that, there is data that tells us that almost 2/3 of Australian adolescents report exposure to online content that actually depicts suicide, that depicts self-harm, drug taking, pornographic content, or violent material. So when we look at this particular Black Dog Institute report, they tell us that these are the factors that paint a picture of modern adolescence as a time now of fewer opportunities for practicing maturity and independence in just day-to-day life, coupled with this increasing exposure to this mature content in a digital world. Now, in one session, I have to focus and narrow down, so I'm not going to be able to explore why is it that so many parents give the devices to their children at such a young age. I'm not able to get into why in Australia, like some other countries, we are prescribing medication for a range of mental health at such an extraordinary rate at such an early age. They're for other sessions. It leads us then into, well, with this information, with our own observations, with our own experience, well, how can we support and actually refer the students who are experiencing mental health challenges? And of course, whether you're a teacher, whether you're a trainer, whether you're in a library team, a customer service or faculty admin role, we've got a job to do. And for most of us, it's really about either supporting or delivering a training program or an education program. And we can be supportive we can be reliable, we can be a source of proven, trusted information, but at the same time, we can't actually case manage individual people's lives. Now, from a learning support perspective, and I spent many years in a student support manager role and a student support officer, we know that virtually all young people will need to hear the key messages several times before they'll actually act or take up the offer of help or support, whether that's counselling help, academic help, learning skills help. And I think it's just a good point to say that in amongst a wealth of data and messaging that is somewhat negative, we shouldn't overlook the fact that, quite simply, sometimes it's the genuine and sincere encouragement and the belief from a practitioner, from a teacher, from a support services person, that belief demonstrated to the young person, I believe that you can do this, that actually can be extremely powerful. We shouldn't forget the predictable and expected transitions, developments, and interactions that young people will experience, just like you and I did. Dare I say, when we were in our adolescent, teenage years, when maybe we made some mistakes, maybe when we made some poor choices, said some silly things, or we're going through a time in our life when we actually just felt overwhelmed or particularly anxious because we weren't sure about where we were at, what we were doing, and how we fitted in. I think as an educator and probably as a parent as well, I think that the young people now finding the boundaries, whether it's relationships, friendships, humor, work, study, it's difficult enough. But our young people now are doing this in an age when every conceivable message, dare I say every contradiction, fake news, disturbing content, unqualified opinion from friends, from family, from celebrities is continuously presented to them through their devices and their platforms. And they are actively encouraged to use their devices and engage in these platforms. So it's a tough gig, I think, for our young people. It really is. Now, when we think about our study context and we look at the surveys, we look at the reports, we look at the commentary, it is still the case that 3 of the most commonly cited barriers that prevent young people from seeking help are that they simply feel scared or anxious to get help. They feel embarrassed, or they have a sense that I can deal with this, maybe I should be able to do with this. And particularly pertinent from an educational perspective is that young people are actually telling us in their commentary that they need more help. They need more help in how to study effectively, how to balance study and work, the basics of how to create a study plan or a timetable. And I think in the busyness of our courses, our training courses, and getting people in, we have a wealth of learning skills and support here at TAFE Queensland. But if they don't know it, they don't know it. And I think occasionally I hear a teacher, and I think it comes from a position of frustration. Why don't they know how to do this? Well, if they don't, they don't. And that means we need to show them. We need to help them to understand what it is to study effectively in a TAFE course, how you do those basics about study plans. I don't know about you, but if you go through an orientation, an induction in a course and everything comes at you, boy, it's a lot of information, and we have to do that. But we've got to remember some of the basics as well. So where do I go from there? Well, when I think about what works, we know that early intervention is really key for our young people, but for anyone, quite frankly. And some of the other commentary from our young people is about not knowing where to go, not knowing what help they need. And there's still those concerns about stigma and confidentiality, particularly if it's anything to do with mental health. So I'm going to share with you something that we've been doing here at TAFE Queensland. Because this is something that came out of conversations with our teachers and trainers. For those of you that can see me, what you've got on the screen, and I'll hold it up for the camera, this is a postcard. Isn't that wonderfully technological and advanced? Why have we done this? Well, we've got lots of information on our website within our learning management systems. We've got electronic notice boards and all the rest of it. So we absolutely promote the tried and trusted evidence-based resources and information, not just for young students, but for students of all ages. The feedback and the conversation talking to our teachers is, of course, that students disclose their concerns the vast majority of the time to the teacher, either in class, after class, in the corridor, at the faculty admin counter. We have student support officers and counsellors, but more often than not, it's the teacher that's the first one to hear the concern. And what our teachers really wanted was a resource that they can provide and give to the student for what we call that in the moment conversation. So if I'm in the moment in class, or before or after a class, and as a teacher, I'm carrying a little pack of these cards. The front tells me, where is my local student support team? How do I contact them? And on the back of those other services, such as Beyond Blue, Lifeline, Headspace, Reach Out, and those services cover all different cohorts, young students, mature age students, our Indigenous students, students who identify as LGBT, all in one little helpful format. It seems a little old school, but it's about simply giving somebody some options and the ability to action in the moment. So if you don't know easily or off the top of your head how to refer a student, at the very least, to who your local support team is, what do they do, when are they available, where are they, it's something you really need to equip yourselves with. And we find that teachers really love these. They're helpful. We've got them in faculty admins and we send out lots of them. So this is a lot about responding to our students. And of course, mental health and educational progress go hand in hand. And I've said before, we're not case managers. Most of us are educators, we're trainers, we're team leaders, we're support services, we're faculty admin staff. And it simply raises the question, what about us? Because our lives have been challenged, particularly in recent years. We have absolutely and continue to experience this incredible pace of life. We ourselves have changed in terms of where's the boundary between my home life, my work life, and all those priorities and challenges that life is just busy. And of course, not only are we having more and more young people disclose concerns to us, we'll have our own mental health worries, concerns, health issues, moments of well-being, whether it's ours or our family or our children. So what about us, I think, is a very important question and a very valid question. So I like to just touch on a couple of things, particularly for me, and I think this is so relevant to TAFE, values and purpose. For me, people in TAFE have very high values and purpose. High values on a professional level for their industry, high values on a personal level, and very clear high purpose. That takes energy. And if you don't restore your energy, frankly, you will experience some symptoms of burnout. Now, it doesn't necessarily mean that you will be burnt out, but you will start to experience some of those symptoms if you don't be active about your well-being, because that is where you get that sense of feel good, and you need the energy to maintain your standards, your values, and your purpose and your drive, and to do it with a smile on your face particularly. So I think if you look at some of these symptoms, we will have all experienced some of these at one time or another. And it's not that you need to experience all of these to be burnt out, and you don't have to have all of these symptoms. But where there is these symptoms and a combination of feeling emotionally overloaded, that becomes problematic. The good news is that this is actually manageable, and some would say highly manageable. And this actually then steps into self-care, which is an action. It needs to be an action. Self-care is something we do. And self-care is really those things that we can do in our own lives that don't require medical attention. And self-care will look different for different people. Before I show you a couple of examples of what we do here at TAFE Queensland, I will just touch on something that I think is key here as well, which is to do with boundaries. And I'm certainly not here to insult anybody's intelligence. Most of us are very experienced people in what we do. But sometimes in the busyness and the pace of life, we're just chasing the next thing. We're running from one task to another. And occasionally it's good to just stop and reflect on what I'm doing, and is it working for me? Is there something that I need to change, to drop? Or if that's not an option, how are my boundaries playing out for me? Because when we're clear about our boundaries, people will better understand what we're good with and what we're not. And frankly, having boundaries is also a part of self-care, which supports our well-being. Having boundaries allows us not to continually say yes to everything, but to actually take a pause, take stock, and make a decision about whether another commitment or responsibility is actually what we need right now. And that applies in our personal and social lives, not just in our work lives. For teachers working with students, boundaries is a really good thing about letting people know what you're good with. And if we think back to when, we had a teacher, or maybe you're studying now, you're studying online in a degree, you get to know your teachers and lecturers and what they'll accept and what they won't. And you can hear it in students sometimes. I need to get this done because they won't accept anything past the deadline, So boundaries can be really useful. And it's not about being inflexible or unapproachable. As I say, I'm not here to insult anyone's intelligence, but it's something that kind of falls to the wayside. So what are some of these simple, proactive self-care measures, particularly when we're talking about protecting and maintaining our well-being? And look, there's lots of different things out there that people can do. There are lots of different health campaigns. There are lots of different initiatives. For some people, it's a walk on the beach. For some people, it's doing their yoga or Pilates. For some people, it's, I'm going to go out and do some fishing for a couple of hours. Well-being is an action. You have to do it. It's an action that you have to have in place. One of the programs that we have at TAFE Queensland is called Mind Armour. So think armour for the mind. And Mind Armour is an e-learning program. It's available to every staff member across TAFE Queensland. We've got over 1,700 staff across the state registered with this program. And when we talk about improving and enhancing our resilience and protecting our mental health, actually at the core of this, it's about mindfulness. It's in a great accessible format, and we're finding that significant numbers of staff actually engage with this program well over several hundred staff a month are actively utilising the programme in different ways and formats. And we've had some great testimonials from the staff in their own words, saying what it's like when you are feeling overwhelmed, when you're feeling that everything's coming at you, when you're managing all these different things. And we use that to share it with others. So my messaging to people is, if it's in that space of mindfulness about protecting your mental health, if you haven't tried it, don't write it off. And there's a lot of free different things out there that people can utilize. We've seen an almost 8% increase in the self-reported adaptive resilience in TAFE Queensland staff who've completed the programme, which is absolutely wonderful. Examples of what else the staff in the programme can access: webinars that are delivered live, that are recorded, that people can watch on their devices at any time, to do with nutrition, to do with sleep and mental health. Interestingly, we've had some great sessions about caring for the carer, because many people have caring responsibilities for elderly family, etc., and other situations. So just some of the things that we think are really important. I'm keeping an eye on the time. Mental health first aid. This is not new. Mental health first aid has actually been around for 20 years. So why am I putting this into an open doors session today? Well, quite simply, we have taken a revisit of mental health first aid, because, as I said, our students more than ever are disclosing their concerns, particularly when it comes to mental health and mental illness, to their teachers and to the faculty admin staff. So we have trained up a number of staff across TAFE Queensland to become licensed mental health first aid instructors. I'm one of them. And periodically, whether it's every month or every couple of months, those staff in their regions across the state can deliver the standard mental health first aid training. And what we have noticed this year is a significant increase in the number of teachers and team leaders and services staff who want to complete their mental health first aid training, because they want to be able to confidently have that conversation in the moment. It's not about being a counsellor. It's not about managing the student's life. It's about having a confident conversation and, of course, referring them to the appropriate support. So whilst that training's been around and we've always had pockets of it, huge numbers. Every course we advertise is booked out within days. So that's a very interesting observation for sure. Well, I mentioned before about our students, and I know I'm talking and I'm saying a lot, but that postcard that we had for the student support mental health and wellbeing services, we have replicated the format, but for staff, because staff need those in the moment options and those actions without having to search around for them. So we have a version for staff, which links to our EAP. It links to our Mind Dharma program, but it also connects them with some of those public tried and tested resources. And again, with enough information in there to cover people of different ages, of different identities, because that's really important. I will share with you just a couple of the reports that I've leaned on for today, which are from Mission Australia, the Black Dog Institute. Let me be very clear. We have no affiliation with these organisations, with the research. I'm simply just taking some of this new information and giving you some insight as to what that's telling us. As I say, I find that turning the tide on depression particularly interesting. If I have interpreted anything correctly from this data, from this evidence, that's absolutely on me. Let me just say that access to mental health services, to valid, trusted mental health information is really key. So let's use what we know is the tried and trusted, and engaging with professional help absolutely improves outcomes, and the earlier, the better. And something that we often don't say in the mental health or mental illness conversation is recovery. Recovery rates, despite the impacts of some mental illnesses, the recovery rates and the return to well-being are very, very good for those who access support. So that's probably where I'm just going to stop and take a breath.
Thank you, Brandon. Yeah, that's just so rich and generous. It's so much to take in. There's a lot of things early on, which is, really thought-provoking and just wakes one up around the challenge. But the richness of the sharing here, I think everyone will really appreciate that. Look, if you do have any questions, to put them in the quick Q&A. I'll start off as to give you a little bit of time. We'll have about 10 minutes and then we'll have an ending of the event today as well. Brandon, I'm curious about what's the feedback loop into other parts of the education sector, whether it's secondary schools or primary schools. How do you share these learnings together?
Look, I'm actually fortunate to be on a couple of national networks, particularly extending across higher education and other TAFEs. And my observation when I was back in a student support role was that I felt a little bit in a silo, even in my own organisation, and that I was having these challenges, but wasn't really sharing with other people what my experience was, when in fact there were so many other people having the same or a similar experience. And it's so important to get into some of these networks, not always just to have this outlook of I must share best practice, but networks just to say, how are we going? How are we actually traveling here? And I think this almost comes right down to team meetings and or faculty meetings, and having the opportunity, because we've always got a full agenda. We've always got a full agenda and we don't always get through it. Just to say, how are we traveling? What are the challenges that people frankly don't want to put down in black and white on an agenda? What is it that we actually need to be talking about? And it worries me that people get a little concerned about discussing mental health or mental illness in our student population. Or is it a confidentiality issue? Am I breaching something? It's actually a really important conversation that can be had appropriately with our colleagues to say, you know what, I'm actually finding this particularly challenging. Because we have such a wealth of experience in our organisations, I don't think we always leverage it off it as much as we could do. But look, to say in terms of other networks, it worries me that, some of the conversations that high school counsellors used to have about the older age groups in high school, it saddens me that counsellors are having these conversations in primary schools that we did not used to have. So things have changed. And it means that we can't fix the world, we can't fix everybody, but we've got to have some insight to just think about how are we communicating, how are we enabling people to get support.
Thank you. Another question that comes to mind is around, you mentioned around the particular challenge of our First Nations people. Is there any other things that you'd like to share about, like different type of groups or segments within, in the student population that have unique challenges or different approaches around that?
I think we've got some work to do. I really do, because there are absolutely clearly those cultural differences. I'm delighted to say that we've, particularly in my role here in the last couple of years, we've really pursued just some conversations about health and well-being that also extends into mental health. This week, we're actually talking to a local Aboriginal and Torres Strait Islander community service about, well, how can we actually target our First Nations employees specifically? Because there are differences. and there are additional considerations. And how can we go about that? So a little bit of consultation goes a long way. I have to say, though, I'm also a mental health first aid instructor. And what I say to people is this. My opinion is quite simply this. I'm not an expert in every single cohort, every single group of identity, whatever that may be. But I'm perfectly capable of saying to someone sincerely and genuinely, are you okay? I'm perfectly capable of saying, hey, I'm a little bit concerned about you. How are you traveling? And I'm not saying I'm going to case manage them. What I'm saying is I'm a human being who has noticed and has taken an interest in cares. Do you need to just talk? Would you like to talk to me? Would you like to talk to someone else? If we can do that, that's a big step forward.
Just a final question. If people are listening in today and they'd like to contribute more to this development of this program and this initiative, or what you're doing, I don't know the right words for it, what could they do?
Well, I'm always open to sharing our experiences of what we've done and how that works. What I would just say to people is there's a wealth of, frankly, fairly patchy information out there when it comes to mental illness and well-being. Whatever you do, there's no lack of resource. Go to the lead organisations if you want to get a flavour of what they do in terms of information for young people, but also information for parents and teachers about working with and supporting young people. We're revisiting in our organisation our training around reasonable adjustment because the landscape's changing and there are different requests under reasonable adjustment today that we didn't see 5 or 10 years ago, and it can be challenging for educators. So we're not denying anybody an opportunity for reasonable adjustment. What we're saying is, let's do this in a really effective way, but let's also look at some contemporary practice. And if we can share some of that, great.
Right. Well, Brendan, I'd like to thank you again on behalf of TDA and everyone here today. Just join with me, everyone who's participating, just to thank Brandon. I'm going to have some final words about the end of today's TAFE Open Doors. Thank you, Brandon. Just to end off our session, as we come to the end of TAFE Open Doors TDA, we'd like to thank you for joining us today. We hope that you found the day enjoyable and insightful. A special thank you goes out to incredible speakers for their invaluable contributions to Captioning Concierge for their expertise with live capturing, and to TDA corporate affiliates for their support. As we bring this event to a close, we encourage you to carry the knowledge and inspiration gained here forward and let it fuel positive change in access, equity, and inclusion in education. Once again, thank you for being part of TAFE Open Doors, a focused discussion on access and equity. Have a wonderful rest of the day.